All right, so we wanted to connect with a lot of our viewers, listeners, either on the podcast or on our YouTube channel, and we want to be able to answer a lot of great questions that we get sent to us almost every day. So one of the questions that we wanted to talk about were breast implants and whether they can cause shoulder pain after about 3 years of having them in place. That is a very rare phenomenon that you're going to have any type of shoulder pain related to the breast implant. Sometimes it is possible that it could cause a little bit of discomfort in the chest area, and that discomfort can radiate, and we call that radiating pain, which means it can go towards the back, like the scapular area, or sometimes it can migrate towards the shoulder area. But those are very rare situations, and not something you should expect to happen with a breast augmentation surgery. Okay, so the next question is, I didn't have large enough pockets to accommodate a larger implant, right, at the time of my breast lift, breast augmentation, which by the way happens to many women. They want to get a bigger implant in the pocket, but when you do the breast lift, you just don't have enough skin sometimes to be able to close everything and at the same time fit such a big implant. So this is actually a really important conversation that we're having regarding that. So would it be possible that my pocket would expand to be able to go up a cup size in several years? Yes, absolutely. Once you give time for the breast to heal completely, you're going to go through a process where the skin is going to start to stretch, and over time you can go ahead and increase the size of your implant. And that would be a much safer surgery, less issues with wound healing or with problems closing the wounds. Okay. What is your recommendation for compression? So it just depends on the type of surgery that we're talking about. For most cases, when we talk about compression, we're talking about liposuction cases. And for those, we would recommend 3 months of continuous garment compression use. The first month we like to use them for 24 hours a day, 7 days a week, and then the second and third month you can transition to about 12 hours per day. Obviously you want to include or incorporate massage therapy as well when you're doing your compression after liposuction. Another question is about Artiss, and that's our tissue glue. If you don't know about Artiss, please check out the podcast. We have the podcast on Spotify that you can log into or become a subscriber to, which would be fantastic for us. And that's called the Beyond the Blade podcast. And I have a very, very detailed interview with the scientists who created Artiss. And basically, the answer to the question is yes, it does eliminate the amount of drainage that's going to come out through a tummy tuck incision, and it's going to shorten the time that you need to have the drain in place. So Artiss is basically just a biologic glue. It has no adverse reactions, no allergies whatsoever, but it allows the tissue to heal back together again very quickly, and it doesn't allow accumulation of liquid. Therefore, your drains are going to come out much faster than if you did not use Artiss. If you combine it with Prevena, it's even better because you have the internal glue that's basically sealing the tissues off on the inside, and then you have the Prevena, which is our incision vacuum dressing system that we put on top of the incision, and that combination is fantastic for wound healing, for less risk of infection, for less risk of hematoma or seroma, which is very important to prevent. Our next question is, how many thigh lifts do you perform weekly? I don't know of any plastic surgeon that performs more than 2 or 3 thigh lifts a week. In general, they're not super common surgeries, but I would say that I perform at least once a week, sometimes maybe 4 or 5 a month on average in my practice, which is pretty busy for thigh lift surgery. Depending on the type of patient you are, you may need to consider a stepwise approach to the thigh lift. You may need to do liposuction first, give yourself time to heal from the lipo, and then consider doing the actual thigh lift surgery. The question is, do I feel that the post-op period is most difficult or most prone to openings out of all other plastic surgeries? Yes, 100%. Arm lifts and thigh lifts have the most difficult time healing. So that is really due to the tension that is created when you have a circular structure like a thigh or an arm. So Prevena and Artis are very, very helpful in these cases to hold the wound together for at least 7 days after surgery and give you the best opportunity to heal your wounds without putting a bunch of stress or tension on your incisions. The last question is regarding breast reduction. Will it always have a skin fold on the inner side of the new breast? That just depends on the patient. That doesn't always happen. Some patients accumulate a little bit of skin at the fold, others don't. It just has a lot to do with your skin quality, skin texture, your pregnancies, whether you had massive weight loss. Those are just independent factors based on each patient. So thank you for joining us on this YouTube channel question and answer period, and we're happy to jump on again and get you more answers.